Welcome to Radi Us, our University of Manitoba Radi Faculty of Health Sciences monthly podcast, where you get to catch up on the headlines from the past month and meet our faculty, staff, and learners making news. We'll also be engaging with our Radi community beyond our UM campuses, so be sure to listen for alumni and partner voices too. The Roundup for the month of April 2025 includes stories about the Helen Glass Research Symposium, a new discovery in brain tumor research, and a family gets a new home with the help of Radi faculty volunteers. I'm Jonathan Wilson from the Radi Faculty Communications and Marketing team. Nearly 150 people attended this year's Helen Glass Research Symposium hosted by the College of Nursing from April 22nd to 24th at Fort Garry campus. Research from graduate students in the college was the inspiration for the theme of this year's event, which was focused on gender and sexual minority health. The event featured keynote presentations from two speakers this year, researcher-in-residence Dr. Athena Sherman and Elder Charlotte Nolan, the symposium's first ever Elder-in-Residence. Sherman, a leading transgender health researcher and assistant professor at Emory University in Atlanta, Georgia, gave a lively presentation on the importance of involving community in gender and sexual minority health-related research. They also spoke about their own funding challenges and being a queer researcher in today's U.S.
But there's still so many countries where we are murdered in the streets, and USA is still one of those. We may not have laws that say it is legal to, but we don't have laws that say it's illegal to. We do not have anti-hate laws for trans and gender expansive folks in the US. We don't have them. We can't even figure that out. And I don't know what that looks like here, but I do know that your voting matters. And it's not just thinking about those larger elections, it's the city officials, right? It's your neighborhood councils. Those matter. Get out there. Keep going. Be that.
Elder Nolan of Angamazwin, Indigenous Institute of Health and Healing, gave a moving presentation about her journey growing up with racism, homophobia, and transphobia in Manitoba to eventually coming out and being able to live as her true self.
The gifts that Creator brought forward for me to enjoy, the love of my relatives, the love of humanity, those are things I cherish. Those are things that I keep close to my heart, my spirit. And I know the dark cloud that's hovering from the States and the dark cloud that's hovering across Canada right now. But we will not falter. We will keep moving forward. And we will stand up for all the young 2S LGBTQIA children, youth, and adults. And let them know that they are loved, they are accepted, they are welcomed, and we'll be there for them.
Jess Crawford was one of 4 Master of Nursing students who guided the symposium's theme. They said one of the highlights was the time spent with Elder Nolan. Crawford said that through conversations with Nolan, they were able to learn more about the role of colonization in 2S LGBTQIA+ inclusive and affirming care.
Yeah, so we've been talking about 2S LGBTQIA+, inclusive and affirming care and health, and one of the barriers to getting that is colonization, and we think of that often as a past situation, but colonization is ongoing and permeates norms in ways that we don't think about. So colonization and colonizers brought with them ideas about gender and sexuality and what is appropriate, normal, moral, those kinds of ideas. And those are ingrained in society. We are controlled by those, even if we don't think about it.
A Max Rady College of Medicine-led study successfully eliminated breast cancer-derived brain tumors in mice. The research team tested 8,500 drugs. They discovered that poziotinib, a drug that already exists and is approved for other cancers, reduced breast cancer brain metastasis tumors in mice after 2 weeks of treatment. Brain metastasis occurs when cancer cells spread from one part of the body to the brain and form tumors. Dr. Sabine Hombach-Klonich, professor and head of the Department of Human Anatomy and Cell Science at the Max Rady College of Medicine, says brain metastasis can happen years after successfully treating a breast cancer tumor and occurs in about 50% of individuals with the specific breast cancer she was studying.
Our study was basically looking for drugs that would penetrate the brain and would also then effectively reduce the metastatic brain tumor. And we found a drug that did that. And so that is a huge success.
Hombach-Klonich says that many cancer drugs that work in other parts of the body can't enter the brain in high enough concentrations to be effective, and brain cells surrounding the tumor produce growth factors that can cancel the success of many drugs. The research team has shown that poziotinib actually has a high concentration in the brain after administration.
It is important because many patients with breast cancer and HER2-positive breast cancer are waiting with that uncertainty, not knowing if there will be brain metastasis and where these will occur and whether there will be a drug that is effective in metastatic breast cancer to the brain. So I think it gives them hope.
Hombach-Klonich anticipates the drug and its use in treating brain tumors will soon be tested in clinical trials. A wide smile crossed Afinois' face when she was handed the keys to her new home at the end of March. She was living in a cramped 2-bedroom apartment with her 3 children. Thanks to Habitat for Humanity Manitoba, she is now a homeowner. More than 55 volunteers from the Rady Faculty of Health Sciences helped construct Afinois' 4-bedroom townhouse in June 2024. It was part of a 5-day Habitat Manitoba build that included students, faculty, and staff representing dentistry, medicine, nursing, pharmacy, and rehabilitation sciences. The key ceremony took place in the living room of Afinois' new home in Transcona. Members of the media, Habitat Manitoba partners, and build volunteers filled the room. Dr. Dieter Schoenwetter, a Dr. Gerald Nisnik College of Dentistry professor, said a few words to the group and presented Afinois with her keys at the ceremony.
A home is much more than just walls and rooms and doors. It's a place where memories will be made. You'll have an opportunity to create dreams here.
After the key ceremony, Afinois said she was happy and excited.
It's a day that I'm going to remember for a long time and even my life, you know what I mean? Because it's been hard. It's been hard. I know that there was no way I could put funds together to get a home with 3 kids, a single mom. It's hard. So I'm so grateful for today. I'm excited and I'm really happy to create memories in this home.
As well as providing volunteers, the Rady faculty also raised $100,000 for Habitat Manitoba. There have been 10 cases of measles reported in Manitoba in April and over 1,000 across Canada, the highest since the disease was essentially eliminated in Canada in 1998. Measles is a highly contagious viral infection that can be serious, particularly in young children and adults with weakened immune systems. It spreads easily through the air when an infected person coughs, sneezes, or talks, and the MMR vaccine is the most effective way to prevent measles. Manitoba's Southern Health Region has Manitoba's lowest measles vaccination rate among 7-year-olds at 53.3% in 2023. Dr. Michelle Dreger, a professor of community health sciences at the Max Rady College of Medicine, spoke to Global News about the factors at play.
We do know that, COVID-19 and the pandemic, and there were a lot of disruptions to people accessing vaccines, so certainly for those childhood vaccines. When we look at vaccine hesitancy, it's often more important to talk about very specific vaccine hesitancies and even to help provide understanding of what are the complications of actual exposure to the disease, compared to exposure to the vaccine.
An up-to-date list of measles exposure sites in Manitoba can be found on Manitoba Health's website. 5 students from the Dr. Gerald Nisnik College of Dentistry recently returned from a dental mission trip to Ecuador. The 4th-year dental students visited 4 communities in the rainforest. Led by Associate Professor of Restorative Dentistry, Dr. Norika Borberg, and Clinical Instructor Dr. Tom Colina, the team performed more than 80 cleanings, nearly 170 fillings, and more than 220 extractions. Brian Kwak said that using the skills he learned during his dental school training felt amazing.
It felt like everything I did in dental school, all the sweats, effort, and the time that I put in was worth it. It felt pretty amazing and rewarding at the end, and it was incredible seeing patients smile at the end and being happy. So it feels like that I contributed to their life in some way. Yeah.
Madison Chambers said it was a great way to end her dental school education.
Yeah, I'd say it was a once-in-a-lifetime opportunity, especially as a student, having that mentorship. I would encourage anyone in third year, second year, first year, even anyone wanting to go into dentistry, that this is something that probably was the best moment of my dental school experience. Not only just for learning about dentistry, working with patients, getting more confident with your skills, and just something that I know that I want to do going forward again. So definitely, contributes to my career in the future.
The trip was organized through a Canadian charitable organization called Kindness in Action, which provides free dental services in countries around the world. Thanks for joining us today. Please send any ideas and feedback to radymarketing@umanitoba.ca. Read more about this episode's stories by checking out the show notes or visiting our UM Today Rady Network news site at news.umanitoba.ca/network/Rady Faculty of Health Sciences.